May I have your permission to use this video for educational purpose on the internet?
Yes.
Now, tell me about your symptoms before our sacroiliac joint fusion. What were your symptoms?
Severe pain going down my legs, down in the calves, throbbing in my calves.
Yeah, not only pain in the sacroiliac joint, but as well pain going down the legs. And for a long time, we didn't understand why sacroiliac joint should give us pain in our legs. But now we understand the nerves are passing over the joint, and so problem of the joint can give people leg pain. Now, how long did you have those symptoms?
Off and on for 20 years.
20 years. What kind of help did you seek, and what kind of help did you get?
I went and had shots in my lower back. I've had radio frequency ablation in my lower back. I had shots at different places, and they would last a day, maybe a few hours, and the next day it'd be right back to where it was.
Yeah. At the end, we did sacroiliac joint injection that temporarily numbed up the joint, proved that's a problem. But as well, for 20 years, you went to spine surgeon or other spine specialists.
Spine specialist.
What did they tell you?
They told me to lose weight.
They didn't really pinpoint the problem. Let me show you. Now, here, this is the MRI, and I can tell you MRI of your spine. This is from recent, but as well your previous MRI of your spine, they didn't show any problem in the spine. So they weren't wrong about that. The problem is not your spine. They just didn't look beyond that, right?
Right.
How did we look beyond that? What did we do differently that could be pinpointed?
You saw it and fixed it, or started fixing it right away.
Yeah, well, we did the injection, we provoked that joint with the exam, then we injected multiple times, and it gave you temporary improvement.
Right.
And then we proved that's a problem, and then we fixed it. Do you remember how we fixed it?
Yep.
Tell me, how did we fix it?
With the surgery and 3 screws put on each side of my SI
Yes.
joints.
And when did we do the surgery?
First one was last March, and the second one was in August.
So tell me, how are you doing? What's the difference?
The difference is there's no SI joint pain and there's no leg pain. I still have my lower back pain, but that part of it is gone.
Yes, so you're able to say the pain that was on the sides and we're going down the leg, you feel that are different.
It's virtually gone. I don't have near the pain there.
How's walking?
Still bad. Still the lower back is very sore.
That's still a problem, but now obviously you're a human. You're allowed to have more than one problem, and we looked at that. You do have some facet problem as well that we are going to address. But how long after the surgery could you tell that this is different? The previous pain in the leg and the sacroiliac joint was gone. How long after surgery could you say that?
Probably 2 weeks.
2 weeks.
Surgery.
So you had this problem for 20 years, and 2 weeks after the surgery you could tell it's different?
Right. Yes.
What would you do different if you had that problem?
I'd have come and talked to you 20 years ago.
or I have a better idea, There's a lot of information online. How did you find us? How did you find about us?
My wife was here, and I researched you online.
Yeah, and that's where I'm going at, For all my future patients, number one, sacroiliac joint problem are often neglected, especially if the MRI of the spine look fine and they tell you there's nothing wrong with you. Go read about the sacroiliac joint, but as well just get information online. I think patients are the best advocate for themselves, and the information is available. Right. You don't have to suffer 20 years. No. Before a 20-minute procedure, 2 weeks after, this is what happened. Right. You had 20 years of problem. We did a 20-minute procedure, and 2 weeks after, you noticed that pain was gone. So, well, thank you for sharing the information this with me, okay? I appreciate that. Thank you.